Good afternoon, everybody. I would like to welcome all of you for this great opportunity to have this seminar for retinoblastoma. I would like to express our thanks and appreciation to Dr. Azza Maktabi and medical education who work hard to make this fruitful meeting existing. I'd like to thank all the guest speakers who accepted the invitation. I'm Dr. Saleh AlMesfer, a pediatric ophthalmologist and taking care about retinoblastoma. For today, I would like to share with you our retinoblastoma experience at King Khalid Specialist Hospital. We have excellent registry for this reason. All the data that we have is obtained from our registry. I would like to express our great thanks to Dr. Susan Simft, who joined KSA ophthalmologist on late 80s as a board eligible pediatric ophthalmologist. She was the founder of retinoblastoma registry. As you know, we have a great group who is taking care of retinoblastoma at King Khalid Specialist Hospital in cooperation with people from King Khalid Specialist Hospital. This is my picture with Dr. David Abramson a few years ago in one of the retinoblastoma meetings. Dr. Susan Simft, now she's practicing her private practice in Hawaii. And the total number of patients that we have in our registry is 1,033. Total affected eyes is 1,464. Male to male ratio is almost the same. Unilateral cases to bilateral cases, about 60 to 40%, and there's 1% of trilateral average number of cases that are seen in annual basis, about 26 cases per year. Our registry started on 1983, and the data that's presented today is up to date. We have unilateral cases of median diagnosis age is 24, for bilateral is 11 months, for family history is about 6 months. If we look at the symptoms that most of our patients, they presented with leukocoria, some cases presented with strabismus or proptosis, pain, red eye, poor vision or cellulitis-like picture. At the beginning, our classification is Resolve-Forth, and it was our classification at the beginning, but with time we would move to international intraocular retinoblastoma classification, which is classified as group A, B, C, D, E. The current workup for all patients is routine. We are doing a clinical assessment, ultrasound, MRI, and MRA for those cases that they may need intraarterial chemotherapy. Sometimes some patients, they ended with routine angiography as indicated. All patients will go through appropriate EOA where everything is documented, including intraocular pressure, anterior segment finding, fundus, refraction, and documentation will rely on the EOA sheet and RITCAM. The current modality available at King Khalid Specialist Hospital is wide range from focal treatment, radiation, chemotherapy, and enucleation. Radiotherapy is done at King Khalid Specialist Hospital, and brachytherapy is provided through the biophysicist department at King Khalid Specialist Hospital. Chemotherapy is done through the pediatric hemato-oncology department at King Khalid Specialist Hospital. We applied the new classification since 2007. We have a total of 481. As you see, majority of the cases are between group D and E. For this reason, you could see that there's about 60% almost are ended with enucleation because they presented with advanced disease. We introduced intravitreal chemotherapy in 2013. We are injecting melphalan as prescribed for intravitreal injection, and we are applying the technique that was prescribed by Dr. Francis Munir. We are taking the same precaution, same technique. Radiotherapy was the older treatment. Rarely now we are doing radiotherapy except for rare cases. But you could see some of these patients who are still in our registry received the radiotherapy abroad. This is a child who was treated in Egypt 3 months, and radiotherapy was applied to both orbits. He ended with this picture, and it was a disfigured face. We have about 38 patients ended with brachytherapy. Second tumor is seen on 13 patients as osteogenic sarcoma. A total of 21 patients. all patients presented with second tumor. Majority are osteogenic sarcoma, and others are spindle cell, rhabdo, leiomyomyoroblastoma, or leukemia, and others. Arterial chemotherapy introduced in 2018, and this was not achievable without the help of radioinvasive consultant at King Faisal Specialist Hospital, especially Dr. Juti. We have a total of 19 patients ended with intraarterial chemotherapy, 3 patients ended with bilateral, 3 patients ended with combination of melphalan and topotecan. This is one of the patients who presented with large tumor, ended with this slide on the right after 3 cycles of intraarterial chemotherapy in the form of melphalan. This is another patient. You could see that the disease is a large retinoblastoma lesion affecting, covering the optic nerve. After 3 cycles, tumor is liquefied, and we're not happy. If you look at the slide here, you could see the liquefied tumor under the subretinal space, and we're not so happy with this finding. But with the follow-up and repeated intra-arterial chemotherapy, the response was great, and all the liquefied tumor disappeared, and we ended with this retracted regressed lesion nasally. Patient vision ended with 20/30, and there was a strabismus managed with botulinum. Now the child has straight eyes and good vision. There's another patient who treated with systemic chemotherapy for his left eye and enucleation for the right eye. And patient did well at the beginning, but with time we noticed that there is an activity in the lesion, and we decided to give IV carboplatin with thermotherapy, but unfortunately it didn't work. All the season the patient was referred for, and you could see that the patient has activities, and we consulted Dr. Carol Shield, where she advised us to do combination of topotecan and melphalan, and this is what happened. And this is before and after. Patient did very well and totally regressed activity. This is another patient treated with IV carboplatin and thermotherapy and controlled in proper way. Right eye was enucleated, the left eye was the remaining eye. There was no indication to go with systemic. For the season, we elect to give carboplatin and thermotherapy, and we were able to control the disease with this modality. You can see that after treatment, patient did very well with normal remaining macula and good vision. One of our interested findings that we have about 47 families with retinoblastoma, 111 patients are affected. Also, there's an interesting finding that we have 21 twins. 15 of the twins are in one eye affected, 3 of the twins bilaterally affected. Both of the twins are affected. This is one of the interesting cases that we would like to share it with you. Child presented in 1983 with bilateral physical eye. She ended with enucleation of both eyes because it was physical eyes. And the right eye shows regressed RB, but there's retrolaminar invasion, and you could see the optic nerve invasion beyond the lamina creprosa. And the patient left eye was totally regressed with scalpel eye. Patient ended with systemic chemotherapy. This case was published on ophthalmology on 1987. She get married with Tom, and we screened her kids. Her first babies were twin, and this is one of the twin with bilateral disease. We treated all the small lesion with focal treatment in the form of thermotherapy. This is the second twin also. We treated him with focal treatment. Now she's the one who presented in 1993, and this is her kids. This is the twin daughters, and both are affected but with vision. This daughter is normal and the boy is normal. One of the interesting findings that we have with 13 patients among our registry with 13Q minus, 8 patients with spontaneous regressed RB, 1 patient with Down, 1 patient with neurofibromatosis, 1 patient with sympathetic ophthalmia. And what is the future of our retinoblastoma patients? I think these patients, if they obtained If these patients provided with a good psychological support and social support, they will do great. Most of our patients are replicated. We have 6 of our patients in the registry are medical doctors. 4 of them are dentists, and 2 of them are internists. This is the first patient who we did as pre-implantation, and the finding was negative. And this is the child fundi examined recently and shows normal finding. The father was affected, and his first baby was normal. The second baby presented to us with bilateral disease, and we treated her. For this reason, the father was not happy to have a third child with the disease. For this reason, we work with him to have a pre-implantation screening where we achieved this is the first baby to be seen at King Khalid Specialist Hospital after pre-implantation with negative retinoblastoma, when negative for retinoblastoma. Future of retinoblastoma at King Khalid in the Saudi Arabia, we try to recruit more patients for intraarterial chemotherapy, and we'll try to invest more time in the genetics and pre-implantation to reduce the number of retinoblastoma cases and to create a new generation without the disease. Early detection is one of the mainstay to help these kids to maintain the globe if possible. I'd like to express my thanks and to all of you, and wish to have you excellent symposium today, and we'll try to utilize our time and to listen to our guest speaker. Thank you very much.